Good evening, everyone, and welcome to AOH Prime Time. And we continue our series in sharing the work at Summit County Children's Services and all they do for families and children in need here in Akron and all across Summit County. And joining us right now, Dawn Boudrie, Department Director, Intake Specialized Services.
Yeah.
Quite a title.
Yes, thank you.
And we're going to talk today about SUIT, a new initiative. This is a new unit that has been formed. What does SUIT stand for?
SUIT is our substance use impact team, and it really is around assessing individual substance use and how is it impacting their parenting, and is there a role for us to further intervene in the life of that family?
Sure. And how do you become aware of the situations? Nothing is typical, of course, but what's the typical kind of call or the situation where you might have to be involved? What initiates it?
Mm-hmm. Oftentimes, our calls are coming from mandated reporters. Most often, you're going to see them in the medical field, given the types of cases that this unit responds to. And this unit is responsible for the substance exposed infants. So that would be a prenatal drug exposure or alcohol exposure. It may also be where there are substance use concerns and the child is up to 12 months of age. And then lastly, we've identified an increase in ingestions of any age child, and this unit also serves and responds to those.
And speaking of responding, what is the typical response or how does this issue get addressed?
Sure. So we have a supervisor with over 20 plus years of clinical experience at our agency overseeing a unit of 5 full-time caseworkers and a part-time caseworker. Those caseworkers' experience varies in life as well as in education and in tenure at our agency. So they're assigned to respond. They're responding, making contact with those families within 24 hours. That entails home visits, and then they do some assessments that families may be accustomed to receiving through maybe a prenatal appointment where they're going to administer maybe an Edinburgh to assess for postpartum depression, and some other assessment tools that they utilize.
We were talking before we went on the air here that there's an issue that this is increased because of the legalization of marijuana.
Yes.
And but even before that. So that's not the only thing that's caused an increase, or how does that affect your work?
So in July of 2016, the federal government adopted or created what is known as CARA, the Comprehensive Addiction Recovery Act. That drove a lot of rules and regulations around how do you respond to prenatal substance exposure. So that required children's services agencies to be notified when a baby is exposed prenatally to legal or illegal substances. And that prior to the discharge of that infant and family from the hospital, a safe plan of care or a family plan of care must be developed. And those plans are targeted to address any identified needs with the infant, the parent or the caregiver, as well as any other household members. So really that we saw a spike in calls of concern to our agency in relationship to that population. And then the legalization of marijuana, again, recreationally in 23, we also saw an increase, although that was related to accidental ingestions, most often associated with marijuana as well.
Certainly when you think of accidental ingestion, the trauma or damage that causes the child could be that at that moment, and medical care could help alleviate that problem at that exact moment. Mm-hmm. But an issue where a mother is drinking or has substance abuse issues during pregnancy, that damage and trauma can last a lifetime. And so the care and response, I would imagine, very different.
Yes, when you're looking at the care and response, really, we really want to take more of a prevention measure when you're looking at prenatal substance exposure. So we want our families to go in, if they are using substances, what else are they connected with? Who are their supports? And thinking through how they can keep a safe home. Likewise, with ingestions, though, there is some similarities because our message is really safe storage. Just because that marijuana is legal, it's no different than what you should be doing in your own home as it relates to securing cleaning supplies or alcohol. Keep it in a lockbox, label it. Toddlers are, frequently ingesting those gummies, those brownies. They're very appealing. In the labeling that's associated with that, the children can't read. And so they're getting into them. They're eating more than they should. So really, we want to see some safe storage messaging around that.
Do you have situations where if a parent discovers their child has consumed something they shouldn't have, that maybe they're afraid to seek medical attention? Maybe they want to, the hiding or the cover up is almost worse than the crime.
Yeah, when you're talking about particularly marijuana, a lot of the symptoms that we're experiencing or we're seeing in those youth, you're seeing tiredness, upset stomach, difficulty arousing that child. So oftentimes parents might delay seeking some treatment because they think their child might be sick or having a flu. And only after several hours of being unable to wake that child is when they're reaching out for some kind of care treatment. So I definitely think parents are worried, but just because they ingested something doesn't always mean we're going to be responding with the removal. We really want to go out, help support you, provide some education, and make sure that there isn't a next time.
That's an important point. Not every one of these cases is going to result in charges, prosecution of a parent. It's more about supporting and educating.
Correct.
Okay. And then finally, the one thing we might want to discuss or ask you about is parents get judged.
Mm-hmm.
Parents get judged, and certainly there's a lot of substance abuse issues and all kinds of issues, but even parents that are doing the best they possibly can, their child could get into something. And speak to that it's not, that sometimes there's cases where just kids do things they shouldn't.
Yeah, kids do things they shouldn't. Really, we want to take it from what is the family doing right? And we really want to build upon those strengths and those natural supports that they already have. Again, every time doesn't mean a removal, but sometimes we do need to get you connected with services and you're not really sure where to go or how to navigate. So our caseworkers do want to partner. They do want to collaborate to make sure, again, keeping child safety at the forefront. How can we work with you to make sure that that happens?
Thank you for coming on, educating our audience and what your team is doing and what this is all about. I appreciate your time and being here today. And certainly we appreciate you tuning in to learn about what's happening at Summit County Children's Services and all the work that they do to support families, to serve our community, and to help kids in need. There is a lot more to come here on AOH Primetime. Stay with us. We'll be back with more right after this.